Phobias. This is a presentation to bring you awareness on phobias, also known as specific phobias. Phobia is a word with Greek origins. It is derived from the word phobos, which means fear or morbid fear. This is our friend phobic Phoebe, and unfortunately, she has many phobias. But today, we will focus on her fear of birds, also known as ornithophobia. So what is a phobia? Phobias are defined as an extremely strong, persistent fear of a situation or a specific object. Phobias are considered a type of anxiety disorders. Anxiety disorders are characterized by excessive feelings of anxiety and fear. What are some signs and symptoms? Phobias are common among many people. In order to determine whether a person suffers from phobias, they must display certain signs and symptoms. For our friend phobic Phoebe, when she sees birds, she immediately begins crying, shaking, and sweating, and her heart feels like it is about to come out of her chest, which then makes her feel as if she cannot breathe. Another sign and symptom of a phobia is when a person tries to avoid a certain object or situation which causes them fear. As you can see, phobic Phoebe is so glad to go home, but suddenly she changes her mind and decides to go to the library instead. Another manifestation of phobias is when a person thinks that the danger of the feared object or situation is greater than what it really is. Poor Phoebe is so terrified of birds that she instantly runs away from them. She can't help but think that the birds are out to attack her. In addition, a main factor of having a phobia is when the fear begins to impair your daily life activities. In Phoebe's case, her fear of birds is so intense that it begins to interfere with her going to school. In order to be diagnosed with a phobia, you must experience these signs and symptoms for at least 6 months. When do phobias develop? Specific phobias occur in people of all ages, but on average, the onset is seen in approximately 2 to 9% of children and adolescents between 8 and 9 years old. In particular, animal phobia is the most common type of phobia. At least 3.3 to 7% of children and adolescents display intense fear towards one specific animal. Studies have shown that girls are more likely than boys to develop phobias, with an average of 91% of females having a specific animal phobia. So what are some causes of phobias? Studies have shown that genetics plays a small role in the development of most phobias. Specific phobias, for example, the fear of dogs, the fear of flying, or the fear of clowns, is not typically genetically inherited. On the other hand, blood injection injury phobias have been found to be acquired through genetics when compared to other phobias. In children who suffer from phobias, the association between things in their environment and their potential consequences usually produce great fear and anxiety. In the case of phobic Phoebe, there have been numerous occasions where she would be outside and encounter birds flying over her head. Unfortunately, every time the birds flew over her, they released their droppings onto her. This unpleasant experience has made her afraid because she now feels as if all the birds are against her. Another cause of phobias is observational learning. Observational learning is when a child learns to be afraid by observing the behavior of others, such as their parents, siblings, or peers. Even the behaviors they observe on television and video games can have a major impact on their own thoughts and behavior. And because our friend Phoebe witnessed the feared reaction of someone being attacked by birds, her own fear of birds intensified. Lastly, informational transmission is another cause of phobias. This occurs when a child acquires negative verbal information from others about a certain stimulus or situation. Because phobic Phoebe overheard her brother's negative encounter with birds, she now perceives all birds as a threat to her life. What are the treatment options available for phobias? One of the treatment options available for phobias include the use of medications such as selective serotonin reuptake inhibitors, and monoamine oxidase inhibitors. These medications will not cure specific phobias, but they may help reduce the symptoms of anxiety. Another treatment option available is known as systematic desensitization. This is a gradual exposure process that requires a few steps. The first step involves mental imagery. The person is asked to imagine the feared object or situation. Our friend phobic Phoebe begins her process by thinking about birds. Second, the person is asked to watch a video about the feared stimulus. In this step, phobic Phoebe is watching a movie called The Birds. Third, the person is then asked to hold an object that resembles the feared stimulus. In this case, phobic Phoebe is now holding a stuffed animal of a bird. Next, in this step, the person is asked to be in the presence of the feared stimulus. As seen here, phobic Phoebe is observing the birds in the cage. Finally, in the last step of this gradual process, the person is exposed to the feared stimulus or object and is then asked to come into contact with it. As illustrated here, phobic Phoebe is now able to pet and hold the bird. Last but not least, another treatment option available for phobias is called exposure therapy, also known as behavior modeling. This technique is when a person suffering from a phobia is taught how to behave by watching someone else interact with the source of the feared object or situation. In this example, phobic Phoebe witnesses her friend's calm demeanor while holding the bird, and because of this learned response, Phoebe is able to overcome her fear and pet the bird. Overall, ornithophobia is just one of many phobias. The top common phobias in the United States include arachnophobia, known as fear of spiders, ophidiophobia, which is the fear of snakes, acrophobia, which refers to the fear of heights, trypanophobia, which is the fear of needles or injections, and lastly, nyctophobia, also known as fear of the dark. If you or someone you know suffers from a phobia and would like more information on how to receive help, please feel free to visit the following websites listed.